Friends, life transforms for many who live with disability. And that's where a role of a hospital, a role of a doctor, and role of an understanding between a doctor and a patient is so important. At the Kokilaben Hospital in the Department of Urology, I, Dr. Sanjay Pandey, as a urologist, reach out to you for an important awareness and an awakening on subjects which are missed out completely. Friends, we follow a motto every life matters. At the Kokilaben Hospital since the last 16 years, as a center of excellence, it is important for us to reach the society and make it happen for all of you who live with disability in the subject of urology and andrology. Let me take it forward in crisp understanding as to what am I talking. So, there are life saving, life modifying, and life changing treatments in urology and andrology, which makes you completely different to what you were. So, you're suffering with few issues, which is unfortunately very common. Let's take this subject head on. We start with ladies first. Women suffer from issues of incontinence of urine when they leak urine, when they cough, when they jump, when they bend for prayers and namaz, when they actually play badminton, when they walk the ramp, or when they are post pregnancy and they are post deliveries and they're post menopausal, and sadly, even when they laugh. So, women leaking urine when they put a pressure on the lower tummy, which is invisible, is called stress incontinence. It's not the mental stress. It's not the stress that we live in this maximum city and this country. It's a stress where the pelvic floor, which is a different floor from what women suffer and from men have, is about the pelvic floor gradually turning weak. It turns weak even in spinsters and women who are not married and never had deliveries because it's a age-old process of progression of change in graceful aging of women. Post deliveries, post pregnancies, the pelvic floor gets stretched and then recoils. Its recoil has to be helped by Kegel's exercises immediately after the pregnancy state and looked at that I don't leak urine after my aspects of pregnancy. It sadly happens that women suffer from this. They may not have undergone that kind of a pelvic floor rehabilitation and they leak a bit, they somehow manage, and then the second pregnancy comes and women leak again. And then after it comes as a age-related change of menopause where hormones are changing, the pelvic floor gradually is already loosening up as a result of that, and loosening has already happened because of two pregnancies. These women suffer from something called as stress incontinence. As age gracefully changes from ladies to mothers and grandmothers, the change is something which is almost irreversible on itself. If I'm 54 today, I will not, never turn 50 again. If my black hairs are turning gray, they will never turn black again. So if we always do what we always did, we'll always get what we always got. It's extremely important for us to wake up to the phenomena that women suffer from incontinence of urine as a result of pelvic floor stretch, which actually is progressive, and women suffer for multiple reasons around. It is treatable and curable. So, friends, stress incontinence is not only treatable but curable. Unfortunately, what do women do? They would see their doctors, they would see somebody else, they would take advice, they would be ashamed to talk about urine, which is a phenomenon. They suffer in their homes while men folk don't have this trouble. So men don't suffer from this incontinence as a result of age, which women suffer. And therefore, many men may not be knowing that their sisters, their wives, and their mothers in the same home would be suffering from stress incontinence, wearing diapers, smelling of urine, worried about when they would leak urine out, and therefore they drink less urine, less water. They would actually be unfortunately going through trouble where the skin is all wet and they are smelling of urine, skin infections happen. All this is not a day phenomenon or a month phenomenon. This progresses year by year, decade by decade. At the Kokilaben Hospital, in a very life modifying and a life changing treatment, women who are living with incontinence, it's time to leave incontinence. In other words, the disability can be removed completely. So, an assessment in the Department of Urology, where we look at incontinence as a very focused kind of an approach, we look forward to them being assessed by us and looked at those examinations, evaluations, hand holding the journey of confidence building to them that you will be dry again. And thereafter, it's all about looking at those women who have genuine stress incontinence without any other dysfunction. They get through a treatment called as mid-urethral sling. Mid-urethral sling is a tape, and that's a tape which transforms women. That's an actual tape which goes in that aspect of the urethra, where a urinary passage is slinged in the mid-urethral level by a possibility of making the hammock again stronger and giving them that tension-free vaginal tape. You can't see that. It goes into a small incision placed so well and it works very well. It works well that when she walks out of the hospital 48 hours later, she is a dry woman, no more diapers. So, are we talking to women who live with stress incontinence? Are we talking to women who are living with disability? Are we talking to women who have probably not been knowing this subject, that women go through it and unfortunately live with it? Women from all over the world, which includes the African nation, the Gulf nations, and in smaller two-tier towns around, have also come all the way to Kokilaben Hospital to get this treatment sorted out. So, friends, stress incontinence is a female phenomenon. This is treatable and curable and reversible. So why live with diapers in your prime of life? It could be 30s, 40s, it could be 50s, 60s, and even 70s, 80s. Women probably continue to suffer so many years, I would say now, so many decades with this. They wear diapers, they live in agony, they don't know whom to speak to. They may have spoken to their physicians, family doctors, they may have spoken to the gynecologist, who themselves are very busy doctors. They may not have been knowing the subject in depth themselves too. Many other specialties miss out this of other specialties. But imagine, while we follow a motto, every life matters at the Kokilaben Hospital, we also look at improving the quality of life of individuals, which is such an important aspect. That's where we are for. And women, you are treatable completely. So all women who have got stress incontinence, when you cough, run, jump, laugh, and you have to wear diapers to work, you have to wear diapers when you go out because of the scare that you would leak, or you actually leak and you wear your life on diapers around. Mid-urethral sling placed properly in a surgical procedure through the vagina in a half an hour, 45-minute surgery would not only treat and cure you, it will transform your life and your confidence. So why wait? Your urologist in your cities, in your locations is qualified to do this. It depends on how many people take up this project in this subject. But female urology is completely to be seen and to be treated and cared. And therefore, women folk who suffer from urinary complaints need to see their urologist. At the Kokilaben Ambani Hospital in a teamwork, we take it forward as a project completely to look at nobody should be wet again. Everybody should be dry. People should be out of diapers. And that strive is again very individualized, a right approach to the right individual. Friends, we were doing ladies first. We are on a topic which I will close later, but I want to take you forward about men first. Men suffer from erectile dysfunction. And we're talking about the next prosthesis where refractory erectile dysfunction, where men suffer from something and they have no cure. Imagine a man in his late 30s, 40s, 50s, and 60s who, on one side, has a good urinary flow or flow is changing and he's seeing his urologist. He misses out an andrologist in us who deeply interested in his men's health, in his sexual health. Men develop erectile dysfunction, which is unfortunately progressive. They could be smokers, which actually adds on to trouble. They could be diabetics, which adds on to microangiopathy and loss of blood supply to the penis. And with all this, they could also be men who could have spinal diseases, neurological diseases, brain diseases, but they want to perform sexually. Unfortunately, they are refractory erectile dysfunction where the medicines don't work. While I talked about women first and a prosthesis which is called as a sling, which changes life and modifies it completely to a point they're cured, men go through a phenomenon of refractory erectile dysfunction, which is treatable and curable by a prosthesis which is called as a penile prosthesis. Something that I continue to implant as an andrologist at the Kokilaben Ambani Hospital to transform quality of life of a lot of couples, a lot of men who are so down and out in their morale because they don't have an erection. And this gives you the erection which you cannot imagine. This has the rigidity, it has got a tensile strength, and you can like this is implanted within the penis. So two such rods getting into the penis in a 1.5 hour surgery where erections are gone for a month, year, and decade and doesn't recover by whatever therapies that doctors are doing across the country is called refractory erectile dysfunction. This is treatable and curable by penile prosthesis. A prosthesis which actually enters your body and probably transforms your life for the rest of your life because then you are capable in the bed, which the morale was gone, you were so deep and out, and you're treatable at Kokilaben Ambani Hospital in the second floor in Department of Urology in Andheri West in Mumbai. I continue to speak on awareness and awakening to a lot of men in men's health, as much in women's health, and take it forward that this subject reaches people who go and suffer through this. So this suffering is not uncommon. Men go through it. Graceful aging, which I did talk about women, men also undergo graceful aging, where they go through this phenomena where a prosthesis is required for those individuals who have no erections left over. Either they are long-standing diabetics or they've undergone a radical prostatectomy or a cancer prostate surgery where the nerves were involved and the nerves had to be sacrificed. There are people who actually have, with age, gone to a situation where graceful aging has bring out erectile dysfunction that is not being managed with medicines anymore. Whatever was working in the past was good. There are men who have got spinal issues and nerve issues. There are men who have got neurological issues. There are men who have had priapism. And there are people who smoke their life out, smoking. So smoking, diabetes, these are all which reach the end organ phenomena where the erections go away completely. Friends, refractory erectile dysfunction is not only treatable but curable. At the Kokilaben Hospital, as an andrologist, my job is to reach to all men and all couples around that if you suffer from this, for multiple reasons, post surgery, post changes in life, post age related changes, uh, penile processes, which actually is implanted within the shaft of the penis, by a surgery through a very small incision, which you have to search where was it done, it would change. So there are various kinds of processes which can be hidden completely, and they all have their own versatility. So if you look at all of them, right from the Indian ones to those which come from abroad, and all of them do wonders to many men who suffer from this. Friends, we're actually speaking on a topic of prosthetic urology. Processes, that is something implanted in the body, improves the quality of those organs functioning. And therefore, we have been touching women and then we touch men. So these are prosthetics in urology, which I continue to use as a urologist, as an andrologist, for improving health of women and men. And it's very important that all these individuals sadly suffer in agony. And therefore, at a platform where I can speak out loud and clear for this to reach to a lot of you in the society, it was important to come to you to get a freedom on a Republic Day. Friends, we are not over yet. We're speaking on prosthetic urology, and two very niche area projects at the Kokilaben Hospital that I've taken up are actually beneficial to people to a very different level altogether. Let's talk in crispness to them too. Number one, there are people who suffer from refractory overactive bladder. Refractory overactive bladder just cannot control urine. Medicines don't work, diapers don't work. Even the botulinum toxin attempts also have not worked, which could work for 6 to 9 months in many patients, have not worked for a group of people who are called as refractory erectile dysfunction. Then there are people who have got refractory hypotonic bladder or weak bladder. This bladder doesn't have a power to contract and push the urine out. The kidneys produce urine. Your job is to empty the urine, which you continue doing well, where bladder contracts and pushes urine out, the passage open and urine comes out. Changes in prostate are treated with medicines and with surgery, but changes in the bladder, which again are progressive, is a sad phenomenon. As I said, when I become 55, I will not be 54 again. When my black hairs turn gray, I will never have black hair again. And similarly, when the bladder turns weak, it will never be the same bladder again. And probably this is completely missed out in the society and even in urological parlance. Friends, this is about talking on Save the Bladder project, a project which could actually change completely the aspect of care we give to the bladder. Bladder is a neglected organ. Urinary bladder is all about we as masters storing as much as urine we can till we reach the toilet, only when we are interested to reach. Sadly, what happens? The bladder stretches, stretches, and stretches. So many of these bladders stretch for years, even for decades, have turned weak completely. They cannot contract anymore. Their contractions are very minimal and they need to be supported. It can happen more so in long-standing diabetes, in spinal diseases, in many congenital diseases that I get to see in the entire domain of urology to A to Z. And we need to actually choose which patient deserves what. Friends, we're talking about a project called Sacral Neuromodulation Services. At the Kokilaben Hospital in the Department of Urology, apart from these two indications, number one, refractory hypotonic bladder where the bladder doesn't contract, refractory overactive bladder where the bladder is contracting too much, diametrically opposite kind of issues where the bladder is actually source of trouble. And then we go down to individuals who have got refractory fecal incontinence. The stool leaks out. Not because there's a sphincteric problem around, but stool leaks out because of the neurological issues suffering through. So many patients suffer from fecal incontinence and see their gastroenterologists. That is completely treatable and curable by sacral neuromodulation services. And finally, people who suffer from chronic pelvic pain. A chronic pelvic pain is treated up in a very heightened fashion, step ladder fashion, with medications, with treatments, with various neuralgia drugs, and identifying the causes. Are the causes in spine? Where are they? And in a subset of patients, just nothing is achieved. They get epidural analgesias, they get various kinds of blocks, and the region in the pelvis is in pain, in agony. You're getting up, sitting, sleeping, and you live in pain. So those refractory chronic pelvic pains can actually be treated because that's the region of the pelvis. What are we doing? We're looking at the sacral nerves, the nerves in the lower part of the spine, as they emanate from the spine. They need a modulation, and one pivotal nerve called the S3 nerve, which needs to be modulated, which helps in urinary bladder, in pelvic health, and in cases of continence requirements for fecal incontinence, is actually stimulated by a very fine tine lead. Stimulated properly, assessed on the table, looked at the responses which we need to look into, and once that is done, we actually place it for a short while temporary to modulate it with a handheld device to reach the highest possible level in the diseases over the next 7, 10 days to 2 weeks. So this first set of procedures only gives us an idea and takes us to match the expectations as a result of modification of a disease process they go through. The second one is a process which is probably done 8, 10, 12, 14 days later, is implantation of this pacemaker. I call it as a pacemaker in the pelvis. If you have a cardiac situation where the heart doesn't contract, now nothing left over. You need a pacemaker in the heart for the heart to contract. That's called a pacemaker of the heart. Similarly, I rate it as pacemaker in the pelvis. What does it mean? This pacemaker is something which attaches to the lead, which has been studied over the last 10 to 15 days to look at the modulation of the sacral nerve, where the lead has been placed along the sacral nerve. And this works wonderful. This works wonderful in the right locations. Therefore, a lot of work goes on the first stage. We spend a lot of work, a lot of time looking at which side of the nerve has to be modulated and the response of which is better than the other. And thereafter, place these leads around, pack it very well. Patient gets back home over the next 3, 5, 7, 14 days. He's in touch. We look at modulating, and that's great stuff that we get in as an interstim. The interstim device, which is I call as pacemaker in the pelvis, is an amazing device. It was always there. The services were missing in the country for quite some time between the 2009, 10, 11, 12, and thereafter it's back now with a bang with a newer version. The batteries now last between 12 to 15 years compared to the era when it was only 5 years. So you need to change the battery every 12 to 15 years as required. These are compatible with MRI, and the era is not far when you get rechargeable batteries, and I never have to go back the second time in 12 to 15 years. At the Kokilaben Ambani Hospital, in the Sacral Neuromodulation Services of the Department of Urology, it feels proud today. Women who were living on catheters, men who were living on catheters, people who had fecal incontinence, people who were had to do clean intermittent self-catheterization where the bladder was not contracting. On an evaluation and checkup to the right patients who could be chosen, the last year has been a boon for all these four indications. Refractory overactive bladder where nothing was working and diapers was the only way out. Refractory hypotonic bladder where there was no contraction to the bladder or minimal contraction where we had opportunity to put catheter 4 to 5 times a day or live a life on catheter. Fecal incontinence, and there are people who actually, given those kind of support where the fecal incontinence disappeared. They don't have to wear diapers for stool leaking out. And finally, chronic pelvic pain refractory to all known therapies in a step ladder pattern. A pacemaker in the pelvis modulating the S3 nerves is an important aspect of care in a two-step procedure, assessing you, taking you forward in a journey for you and your family. So that's a great prosthetic urology existing a lot of times, affordable now. People can probably utilize the services, and I think it looks very good. Our colleagues in the country also do it. It's important that centers do pick up these kind of services, keep it very focused, and we probably will be very happy to take it forward to the next level. Friends, we are not over in prosthetic urology. As I come to a close, there's one prosthesis which has actually arrived in the country, and that is an amazing prosthesis we've implanted recently. And we continue to look at men who develop incontinence. We go back to men again. Sacral neuromodulation was gender specific, non-gender specific. It could be for men, it could be for women. We had the female urethral tape, which is only used for women who go through stress incontinence. A very large subset of women suffer and completely treatable. We have men with refractory erectile dysfunction who are smokers, who are diabetics, spinal diseases, no erection, failing everything, trouble with their partnership in the bed. And this completely changes around by getting as a processes, giving that hardness, which they probably get the confidence back, the morale is boosted, and the life is transformed. Friends, while every life matters as a motto, look at this amazing reservoir and a handpiece to be modulated by the patient in the scrotum, and that is the cuff which you can see opens and closes up. You can see the cuff opening and closing up as I play with the cuff. So this is the way the cuff closes down the urethra completely and looses up completely by an artificial urinary sphincter. So sphincteric loss happens to men who undergo prostate surgery, more so prostate cancer surgery, more so sometimes TURP, and individuals leak urine. They leak urine continuously. So it's not a stress incontinence alone, it's a total incontinence of men who undergo prostate surgery where a prostate cancer has been completely removed. By exercises, by biofeedback, by pelvic health rehab, many men completely come back to life in 6 weeks to 3 weeks at the Kokilaben Hospital. When I do robotic radical prostatectomy and look at the hood technique, the sphincter preserving technique, I make it a point that we rehab individuals, look at that they don't go through this trouble. For all men who have undergone prostate cancer surgery in this country and everywhere, if you are leaking urine After 6 months to 1 year also, and living a life on diapers, it's time to embrace an artificial urinary sphincter.